Hello everyone. Welcome to the YouTube channel of Shree Swaminarayan Physiotherapy College. Myself Dr. Himani Bharwad. I am lecturer at Shree Swaminarayan Physiotherapy College. Today I'll be going to cover the topic claudication. Let us see. We'll see the introduction, which are the types, the quick differentiation and a summary. Claudication is a kind of pain, cramping or fatigue in the muscles, typically in the legs, which occurs during exercise due to inadequate blood supply, ischemia, and it is relieved by rest. Claudication is the most commonly associated with peripheral arterial disease, PAD. There are two types of claudications, vascular and neurogenic. First, let's see vascular claudication in detail. Causes: it can be due to reduced blood flow due to atherosclerotic plaque. As we can see in the picture, there is one normal artery. The second artery is having atherosclerotic plaque, leading to reduced blood flow. The pain is usually bilateral. It occurs in calf, foot, thigh, hip, or buttocks. Pain is consistent in all spinal positions. Pain is brought on by physical exertion, such as walking or walking uphill. Pain is relieved promptly by rest. Site of stenosis or occlusion. The site of pain provides an indication to the site of disease. So there can be various sites in which the pain is occurring that can lead us to the diagnosis of which are the site in the artery that is getting involved, such as common iliac artery, common femoral artery, superficial femoral artery, etc. In case of vascular claudication, it is important to note that the pulse that we can measure by using the palpation method. As you can see in the photo, they are palpating the dorsalis pedis artery. So the pulses of the lower extremity may be decreased or absent. In case of vascular claudication, physical changes, that might be color and skin changes. Feet might be cold, numb, dry. There might be dry and scaly skin with poor hair growth and nail growth. It affects the ages of 40 to 60 years. Now let us see neurogenic claudication. Causes: compression of spinal nerves, such as lumbar spinal stenosis. So it is a condition in which the lumbar spinal canal, the diameter of that decreases, and that leads to compression of the spinal nerves. Pain: the pain is usually bilateral but may be unilateral as well. Neurogenic claudication, it occurs in back, buttocks, thigh, calves, and feet. The pain is decreased in spinal flexion, but the pain increases in spinal extension. It is important to note that in case of neurogenic claudication, that it changes with the spinal positions, as you can see in the photo as well. Pain increase with walking. So it is important to note that the pain of neurogenic claudication is decreased by recumbency, burning and dysesthesia from the back to buttocks and leg or legs. Dysesthesia is kind of a painful, unpleasant, discomforting sensation that is felt. So there will be burning and dysesthesia from back to buttocks or leg or both legs. Pulses, yes, so it's important to note this point as well, that in case of neurogenic claudication, the pulses of the lower extremity are normal. Physical appearance, there would be good skin, nutrition. This affects ages of 40 to 60 years. So let us see a quick differentiation. As you can see in the table, vascular claudication versus neurogenic claudication. The pain in vascular claudication is related to exercise and it occurs at various sites simultaneously. Neurogenic claudication, the pain is related to exercise and sensations spread from area to area. Pulses in the vascular claudication may be absent. after exercise. Neurogenic claudication, the pulses are still present after exercise. Vascular claudication, the protein content in CSF is normal, and in neurogenic claudication, protein content in CSF is raised. Vascular claudication, sorry. Vascular claudication, the sensory changes are variable. In case of neurogenic claudication, it follows the dermatomal pattern. What is a dermatome? It is a skin area which is supplied by a single spinal nerve root. Vascular claudication reflexes are normal, but in case of neurogenic, reflexes may be absent or decreased. Differentiation of neurogenic and vascular claudication. Vascular claudication, we can confirm the diagnosis by using the ankle brachial index. It is a method in which the systolic blood pressure of the lower extremity is measured at the site ankle, and it is divided by the blood pressure measured of the arm. So systolic blood pressure of lower extremity divided by systolic blood pressure of upper extremity, and we get a value. If the value is below 0.9, it is an indication of reduced blood supply or blocked arteries. So it can be confirmatory diagnosis for vascular claudication. About neurogenic claudication, we can confirm it by using the MRI of spine. So these were the confirmatory diagnostic procedures. References: David J. Magee. Thank you so much everyone for watching this video. Please like, share and subscribe to our channel. And if you have any doubts, please comment in the comment section. Thank you.